I'm grateful for the opportunity to present at the International E-Conference on Cancer Research 2019. The topic of my presentation today is Breastdefend enhances effect of tamoxifen in estrogen receptor-positive human breast cancer in vitro and in vitro. The paper was published in 2017 at BMC Complementary and Alternative Medicine. Breast cancer is the most common cancer in women, which affects 1 in 6 or 1 in 7 women, and we all are aware of the devastating effect of breast cancer. In principle, if we had to divide breast cancer into 2 basic groups, they will be divided into hormonal sensitive, estrogen positive, estrogen and progesterone positive, and estrogen and progesterone negative, often triple negative, or HER2/neu positive, but estrogen negative and progesterone negative. And the treatments for these cancers post-initial chemotherapy are very different. Women who are estrogen positive have the ability of getting treated with hormonal blockades of different kind, either receptor therapies such as tamoxifen or aromatase inhibitors. While there is a clear distinction when it comes to this therapeutic strategy between triple negative and estrogen positive breast cancer, when it comes to the realm of natural ingredients and the ability to combine them together, we have a possibility that the same formulation will be effective for both triple negative breast cancer and estrogen positive breast cancer. In this sense, this formulation, Breastdefend, is very unique. Prior to the paper that I'm presenting today, we have published a number of papers on this formula. In these papers, we have shown that Breastdefend was able to inhibit in vitro and in vivo both triple negative breast cancer with high metastatic potential as well as estrogen positive breast cancer. Breastdefend was able to significantly reduce the metastatic potential and metastasis to the lung from triple negative breast cancer that was implanted in the mammary pad of mice. Breastdefend includes a number of ingredients. It includes Scutellaria barbata, Bangilein, turmeric rhizoma, Curcuma, astragalus, as well as quercetin. It also includes a proprietary blend of medicinal mushrooms, Coriolus, reishi, and Phellinus. What's unique about these mushrooms is that they are grown specifically on immune-enhancing and anti-cancer botanicals. So the mushrooms are being nourished and grown on these herbs, and as a result, the immune-enhancing and anti-cancer properties of these mushrooms can be enhanced. It also includes DIM, diindolylmethane, at a significant milligram dose. What is interesting is that some of these ingredients, specifically, for example, DIM, have shown to have effect on both triple negative as well as estrogen positive. More than this, DIM, for example, was shown to reduce the expression of BRCA in double-blind clinical trials. So when we put such a formula together, the idea is to enhance the effects by creating a synergistic effect, and also to provide some compound that can reduce the side effects of conventional treatments. So this is the logic behind Breastdefend. We have shown in previous papers that by combining such ingredients, we can reach an effective in vitro and in vivo effect at much lower dosages compared to using a single ingredient. In the specific paper that I'm presenting today, we compared the anti-proliferative effects of Breastdefend to tamoxifen and their potential synergistic effect in inhibiting the growth of MCF7 estrogen positive breast cancer that was implanted into the mammary pad of the mice. MCF7 cell lines were treated both in vitro as well as in vivo. In addition, we analyzed the tumors in the Breastdefend group, in the tamoxifen group, and in the combination group compared to control to see if there's any specific change in gene expression between these groups. Once the tumors established, the mice were randomly divided into 4 groups of 13 animals each. Control group, Breastdefend, Tamoxifen, and combination of Tamoxifen and Breastdefend. The key assessment in response in the in vivo group was changes in tumor volume. Compared to the control group, Breastdefend and Tamoxifen had similar effects in reducing the growth of the primary tumors compared to control. However, when Breastdefend and Tamoxifen were combined, there was a significant reduction in tumor volume compared to Breastdefend or Tamoxifen alone. The results of the combination of Tamoxifen and Breastdefend on the regulation of expression of apoptosis-related proteins. We looked at BRAF, P21, BCL2, and fibronectin. While Tamoxifen had a very small effect on increasing the expression of P21 and oncogene suppression protein, Breastdefend enhanced it much more significantly, and the combination had a similar effect. Looking at BCL2, which enhances the aggressiveness of the tumor and the metastatic potential, Breastdefend and Tamoxifen reduced and decreased the expression of BCL2, and there was a synergistic effect. And when we looked at the effects on fibronectin, there was a clear synergistic effect when Tamoxifen and Breastdefend were used together. Figure 2 shows the effects of Breastdefend, Tamoxifen, and the combination on tumor volume. It clearly shows a synergistic effect when we are using Breastdefend and Tamoxifen together. To summarize, in this study, we have demonstrated synergistic effects between Tamoxifen and Breastdefend, and we also demonstrated the effects on protein expression that can explain the synergistic effects and the benefit of this combination. In the past, we've already shown the ability of this formula to significantly reduce the metastatic potential and metastatic tendency in triple-negative breast cancer cell line, in vitro and in vivo. And we also now have some preliminary pre-published data showing the possibility of this formulation to prevent occurrence of triple-negative breast cancer in animals, in mice with tendency for spontaneous expression of triple-negative breast cancer. The next step, which is very natural, is the movement into clinical trials. We are now in the final design and submission of 2 clinical trials that will test this formulation, both in estrogen-positive breast cancer patients between diagnosis and surgery, and in triple-negative breast cancer post-first-line therapy where there was residual tumor in the surgical tissue that was removed, but there were clear margins. We hope that with these studies we can establish more accurately the role of this formulation, how to optimize it, and how to use it with other therapies. I'm grateful again for the opportunity to present at this conference. Thank you.